Hi, my name's Tim Bale and I am co-director of the Myelin Institute here at Queen Mary University of London. Welcome to another of our videos by Professor Sophie Harman of the School of Politics and International Relations here at Queen Mary University of London. In this one, Sophie is going to be talking about the fact that pandemics have to be fought not only by healthcare workers and the healthcare system, but by all of us as a community. If you enjoy this video, please come back and watch more, and we'll see you again sometime soon.
Hello, I'm Sophie Harman. I'm a Professor of International Politics at Queen Mary University of London, where I teach and conduct research into global health politics. Today I want to talk about community involvement and how community is key to responding to outbreaks. Now, we all know how hard medical professionals, doctors, nurses, hospital cleaners, scientists, lab technicians, call responders are working to respond to coronavirus. And it's really key that we keep putting pressure on our governments to fully support these health workers, ensuring they have the right equipment, capacity and resources to do their job. Key to this has been how people take to their balconies at night, cheering health workers, how you may have shared those kind of viral pictures of doctors in scrubs saying, I'm staying at work, so you stay home. And this is great. This is all about promoting understanding and support for health workers and putting pressure on those in positions of authority to resource them correctly. You may also find yourself being a little bit of a hobby epidemiologist, looking at graphs, looking at the epidemic curve, looking at the data that's coming in, discussing this with friends, thinking of different ways of flattening the curve in ways you wouldn't even have expected last year. This helps you have an understanding of what's happening with the outbreak, which in turn allows you to have some sense of control in these really crazy times. You may also have given extra money to a food bank, perhaps looked in on a neighbour or someone vulnerable, hopefully at a safe distance, of course, or reached out to your local authority council to see how you can help. This is all fantastic, and it's also more than just goodwill or good nature and make you feel good about society. It's fundamental in how we respond to outbreaks. Community engagement is key to combating pandemics. We have seen the role of communities in lots of different global health issues. Originally in HIV/AIDS, where communities were hugely mobilised to respond to the outbreak when states weren't very active. We've seen it in Zika in Brazil, where community health workers went door to door to talk to people about safe practices. And perhaps the main game changer was looking at what happened with community engagement in West Africa, specifically Liberia, Guinea and Sierra Leone. A fundamental part of involving the community in the Ebola response was not just about sharing information and making behaviour change. It was also about sourcing knowledge from the community itself. It was about co-produced knowledge in this sense, not just about telling people what to do, but how they made sense of the epidemic themselves. In the 2014-2016 Ebola outbreak, there was a real question about how progress was not going as fast as it should. And the key issue here was public health's favourite, behaviour change. How do we get people to act differently? And I think I'm personally struggling with this myself. How do I act differently now we have coronavirus in the UK? One of the problems we have here with behaviour change is that people don't necessarily trust the information they're getting. Or they feel scared, so they don't know what to believe. And you always have that irrational part of your brain where like, oh, okay, well, who do I believe or who do I not? This is exacerbated if you live in a country where you may have a weak health system that's never provided for you. So why would you trust the health system when in the past that's been really problematic? What we saw in the Ebola outbreak is people mobilised local community leaders to really educate their friends, neighbours, citizens in the response. So in Sierra Leone, this was really about mobilising the Paramount Chiefs. So the Paramount Chiefs are local leaders that have incredible trust in the community. They're also politicians, so there's a little tension there. But it wasn't just the Paramount Chiefs. There was also people who were respected in the community, so community health workers, people who were trusted, who they trust the information from. We all know that you trust information from certain people. I personally don't trust all politicians, but you need to trust politicians when there's an outbreak. Key to this is then mobilising the different communities. It's not just behaviour change. We also saw communities in the Ebola response empowered to do contact tracing, finding out who had Ebola, who was that person with Ebola, who had they seen within a certain specific time, and to notify them to get them tested. So this is so important because it empowers communities to feel involved at a time when you have a loss of control. So community engagement, therefore, is so fundamental because we have to change our behaviours, each of us, if we're going to respond to this outbreak. We also have to feel like we can do something at a time which we have a loss of control. And also we have to come together to show support for those who are really trying to respond to the outbreak, the health workers. Combined, this will help us respond to coronavirus.